welcome everybody to what I believe is one of the most critical discussions we'll have today, how deeply intertwined nutrition and health are in shaping the next generation of Africans. We've got an incredible group of panelists, each of whom brings their experience in health, nutrition, and agriculture to the urgent conversation. Thank you all for being here. We'll start with Minister Pierre Dimba. What are the biggest challenges facing access to quality healthcare in Côte d'Ivoire? And what step is the government taking to ensure universal coverage? So I will ask the question, I'm sorry, because Minister Pierre Dimba will explain himself in French. So, Minister Pierre Dimba, quels sont les plus grands défis auxquels fait face la Côte d'Ivoire aujourd'hui en matière d'accès aux soins de qualité, et quels sont les efforts que met en œuvre le gouvernement pour assurer la couverture universelle?
Je voudrais vous remercier de nous convier à ce panel et vous dire que je suis très heureux d'être ici. Vous savez que Covid-19 nous a démontré qu'investir dans la santé est très important pour le développement économique de nos pays, assurer la croissance économique et lutter contre la pauvreté. Et nous savons qu'après Covid-19, nous devons nous préparer à faire face à d'autres épidémies, tellement les dépenses de santé en période de Covid ont été catastrophiques pour nos États. Donc, il est important que d'abord nos pays se préparent, se renforcent pour disposer d'un système qui soit à la fois résilient, efficace et pour prendre en charge également les populations dans leur diversité, que ce soit les enfants, les femmes et les populations vulnérables. Donc, disposer d'un système qui soit non seulement accessible à tous, physiquement. Pour cela, il faut répartir de façon équitable sur le territoire les établissements sanitaires qui soient les plus proches possibles pour ne pas générer d'autres types de dépenses, mais également disposer du personnel qualifié, en grand nombre, partout, répartis à travers tout le pays, et disposer des médicaments. Ce n'est pas toujours évident parce que sur les derniers kilomètres, même si les grandes villes, nous avons, avec tout ce qui est fait, la disponibilité des médicaments, en milieu rural et dans les centres un peu isolés, il faut prévoir que ces médicaments arrivent pour prendre soin des populations. Et l'accessibilité financière est une question. Mais à ce niveau-là, nous avons travaillé, je reprends en même temps sur ce que nous faisons, donc à mettre en place la couverture maladie universelle, qui permet aujourd'hui, avec 1000 francs pour les populations par mois, pour les populations d'avoir accès à des soins de santé pris en charge à 70% par l'État et 30% par les populations. Les populations vulnérables, bien entendu, sont prises en charge à 100%. Et nous sommes à plus de 52% de la population qui est enrôlée à ce jour, et nous sommes sur la bonne voie. Alors, les défis, comme vous avez dit, sont des défis de prévention, parce que les moyens ne sont pas toujours disponibles. Donc, on ne peut pas attendre que les gens soient malades pour les guérir, surtout qu'en plus des maladies infectieuses qui représentent un lot important des malades que nous recevons, nous avons les maladies non transmissibles de plus en plus qui viennent en grand nombre dans nos centres, le cancer, les maladies cardiovasculaires, le diabète. Donc, il faut vraiment prévoir, il faut prévenir ces maladies, faire en sorte que la promotion de la santé permette donc d'éviter ces maladies par une hygiène de vie, en préconisant que les gens, par la promotion de la santé, fassent du sport, par la nutrition, mais également par la qualité de l'environnement. Et je pense que c'est cette question-là que nous sommes en train de traiter de façon multisectorielle avec les autres ministres en charge de ces questions.
Merci beaucoup, Monsieur le ministre Pierre Dimba. Hada, why are investments in farmers and agriculture so essential to addressing malnutrition and improving maternal and child health outcomes in Africa?
Thank you. Honorable Minister, how does it feel to be in the presence of these amazing women all around you right now? So we're a force, so please give him a hand. It's such a pleasure to be here. And that's a very pertinent question. I just think it's amazing, the organizers putting the health and agriculture together, because at the end of the day, the foundation of good health is good food. And farmers are at the center of that, period. So, UNICEF just brought out results recently that due to the economic crisis, the conflicts, the wars around the world, 25% of children under the age of 5 are undernourished. They're facing severe hunger. And, I know we throw around numbers all the time, but these are children under the age of 5. It's staggering. And when I worked in the Agriculture Ministry of Nigeria a few years ago, I feel for me, one of the biggest things that were left a mark on me was just understanding the extent of malnutrition in my country. In the northern part of Nigeria, 1 in 5 children were malnourished. 1 in 3 children in Africa are stunted. That means they can't grow tall because they don't have the right nutrients. You have 40% of the population in sub-Saharan Africa that just is undernourished. And what's the implication here? Bottom line, these kids, these children, they can't develop properly. They don't have the nutrients. They don't have the mental capacity. The first 1,000 days of a child's life is the most important for brain development. So at the end of the day, we had a panel earlier on talking about human capital. We can't talk about human capital if we don't deal with the issue of food and hunger and malnutrition. So for me, it's the center of everything. I believe the World Bank even has research out there predicting that there's loss of productivity of about $3 trillion annually because of malnutrition and undernourishment. So it's an acute problem that we need to pay attention to. And it's great to see that donors increasingly are looking at this. Philanthropy is looking at this. And I believe the Gates Foundation just pumped about $2.8 billion into Nigeria towards agriculture, nutrition, and health. And it's in areas like fortification, putting vitamin A in the staple foods that we eat every day, into the cassava, into the sweet potatoes, into the bouillon cubes that we put in our stews to give it flavor, into the vegetable oil that we use. This improves the immune system, and it's so vital. And as you think about the fact that about 26% of pregnant women in sub-Saharan Africa are anemic because they just don't have the $2 required for the period of time that they're pregnant to get the right nutrition and to feed their unborn children. So these things are happening, but as we think about all the investments going in, to me it's futile. It's futile if at the foundation of it all, agricultural productivity isn't there. We need to increase our farmers' productivity, their yields of nutritious crops, of proteins, eggs, we have to livestock, milk, calcium, all these things need to be improved. And to do that, you need to industrialize, you need energy. I'm an entrepreneur, and I just know how much we spend every single month on diesel costs because we power and we provide our own energy to run the business. It doesn't make sense in Africa. So energy access, distributed energy to the poorest of the poor, to places that maybe the government cannot get to, is important. And it's good to hear that, EDA and the World Bank, these are things that they're focusing on as well. So investments in those areas. And finally, I just feel like we talk donors and stuff. I think another panel mentioned it. It's how do we bring public and the private sector together? The private sector has a strong role to play. I have a business. I run a chain of healthy food restaurants in Lagos because I saw this issue. I saw this problem and I wanted to deal with it. The donors were dealing with the rural areas, with the malnutrition and the stunting. But we actually have overnutrition as well. Obesity. We have 9.4 million people dying every year from hypertension. Nigerians are 2 times more likely to die from hypertension than other Africans. And it's because you have ultra-processed foods increasingly in these urban areas. High salt, high sugar, obesity. So these are issues we need to deal with, and agriculture is at the center of it all.
Thank you, Ada. Dr. Uche, thank you also for being here. With the increasing challenges from climate change, disease outbreaks, and economic pressure, what key actions are needed to strengthen health system resilience, particularly in ensuring vaccine equity and improving maternal health?
Yeah, thank you very much. And I must start by saying I'm truly excited to be here because when I did get the invite, I was wondering, as a clinician and a global health expert, it's great to see that health is taking the stage in economic and development conversation. So I'm really excited to be here and kind of seeing that link between health, our economies and development. So it's great to really be speaking on this panel. So with regards to what we're seeing with climate change, with disease outbreaks, with economic pressures knocking at the door of Africa, I think it's time that we stop to patch the roofs and actually rebuild the house from ground up. And what am I referring to in this context? We need to look at ways to strengthen the health system. I think we use these words very loosely, health system strengthening. We know that WHO has the 6 building blocks, all 6 of them, we know them, but are we actually true to them in terms of are we implementing? So for the purpose of this, for my responding, I'm going to really focus on 3 key areas that we need to really tighten up if we want to see a change in health and development. And the first is around strengthening and investing in the health workforce, right? There's no health system without the health workforce, because for every disease area or program, you need the health workers. They're actually the center of what we do. So what are we seeing? There's a global shortage of health workers, right from the clinicians up until you get to the community health workers. We don't have enough health workers. And for Africa particularly, where we contribute 25% of the global burden of disease, we only account for 3% of the health workforce globally. So it means that we need to do something right in terms of quantity and quality. And it's not just about recruiting and training. We also need to think about equipping them, because it's very frustrating as a health worker. I've worked as a clinician in a rural area, and you don't have the tools to work. There are no commodities, they're stock out of medications, iron and fesolates and all of that. There are no commodities. So we need to not just train and retrain, we need to equip and retain. We need to be able to retain our health workforce. We're seeing what's happening with brain drain in Africa. Everyone's moving out. Right now, we're having health worker to patient ratio of 1 to over 5,000. The standard should be 1 in 500. So the health workers are burnt out, they're exhausted, we don't have enough. So I think we need to, start walking the talk and ensuring that we invest in health workers. I would give an example of Ethiopia. Ethiopia scaled up the health extension program a couple years ago, and just that initiative alone saw a decline in maternal mortality just by investing in community health workers. So I think that's something we need to do. The other piece, and this speaks more to the vaccine equity side of things, is ensuring we can locally manufacture our own vaccines. And also, more importantly, strengthen the supply chain systems. COVID taught us a big lesson with vaccine distribution and equality. So Africa as a continent was heavily reliant on external, vaccine production, and that's kind of caused a lot of disruptions. So when other countries were having over 70% vaccination coverage, we're having less than 10. So we're looking at how can we as a continent start to manufacture. And I was very excited to hear a couple of days ago about the Partnership for Africa Vaccine Manufacturing, which has a plan to ensure that 60% of the vaccines produced would be produced locally in Africa by 2014. I think that's a great first step. We need to ensure that this is happening locally and we can sustain it and it gets to the last mile. So we're able to cover in terms of immunization coverage and also supply chain systems, which is a totally different kettle of fish. And then lastly, I want to just speak to one more thing, which is still part of the health system strengthening, is our data. We should be able to strengthen our data systems, strengthen information systems, because we need all of the data and information to plan, to resource our health facilities, to decide how much health workforce do we need. So strengthening our data and using them for decision-making, using them for planning would go a long way, in improving our healthcare system amidst all of these shocks we're seeing currently.
Thank you, Dr. Uche. To continue our conversation, Marie-Ange, Gavi is aiming for a $9 billion replenishment. If fully funded, what we all hope, how will this impact Africa healthcare systems?
Well, thank you first for having me here, and thank you for the government of Côte d'Ivoire and, of course, Global Citizen and Bridgewater. I think one of the key ways really Gavi as a public-private partnership, and really a partnership with the government, and I'm very pleased to be sitting here with the minister that is a key partner for us, and so many also in the room, but also the private sector, civil society, and investors, is really, looking at how actually we work together on this nexus between health, climate, and nutrition. And the reason why it's so important is that actually the immunization system is actually the backbone of the health system, because a mother will always bring her child to be vaccinated. So at the same time, you can check all of these other things that are needed, check her blood pressure, provide the nutrients for, to make sure that the kid is well immunized. So doing this, of course, Gavi, in partnership with the government and the partners that I've mentioned, has helped immunize more than 1 billion children. And what we plan to do for the next period, strong from our lessons, is to immunize actually the next billion in half the time. And it's critical because we heard it. There's climate change, there's conflicts, there's population growing. And so we need actually to accelerate. And the minister said it so well, prevention is actually going to be what is going to allow Africa to rise. And so in the next period, the first thing that we are doing, of course, and you are already seeing it here, is bring these new vaccines. Science has been prolific. We have now 2 new malaria vaccines, and we were very excited to, introduce them here in July over the summer here in Côte d'Ivoire. So that's very important. We know how debilitating the disease can be. So malaria, dengue, the vaccine against cervical cancer that is now killing a woman every 2 minutes. And this is very important. So we have the possibilities. We also have, actually a portfolio of vaccine. 50% of the vaccine that we have in our portfolio are actually for diseases that are climate sensitive. Diseases that we see, erupting a lot with the climate change, malaria, cholera, yellow fever, typhoid. So these are available. So it's about protecting the people and having the widest portfolio of vaccine being available. It's also about protecting communities, and that's why health system is very important, because it's actually modernizing these health systems. With the partnership with the private sector, we are able to have better logistics, being able to develop vaccine much faster, being able to have a better cold chain, to solarize the cold chain, so that, we can actually, we now have vaccine that can be outside the cold chain for, a few days, and that can stand at 40 degrees. All this is through this critical partnership that we have with the private sector. And of course, all this, what does it do? It protects the world, because then we prevent outbreaks. We do have global stockpiles to help actually support countries as soon as something happens. But I think what I want to insist on, that is, that we are going to incentivize in this period, is really the partnership. Dr. Uche talked about it. We have launched a great initiative, the African Vaccine Manufacturing Accelerator, that we have capitalized at 1.2 billion to actually encourage regional production in Africa. We have, different partnership with the private sector, but also an even stronger partnership with the countries. And that's what we want to see going forward.
Yes. It is clear that to ensure a healthier and prosperous Africa, we need definitely collective efforts. Given the intersection between food security and healthcare, EDA, what steps are necessary to strengthen both nutrition and health system resilience in Africa, especially as the continent faces rising threats from climate change and disease outbreaks?
Yeah. Thank you. I feel like that nexus of health and nutrition and agriculture is clear. We sort of all agree, and it's the power of this conversation today to have all these people here. But I do feel like the first point I would make is around partnerships that Marie-Ange was just referring to. I still remember getting really frustrated when I worked at the Ministry of Agriculture in Nigeria, and we'll be talking about nutrition issues and the impact on malnutrition and death and all of that. And we just couldn't really connect with the finance, with the health ministry. So it's just like people weren't talking to themselves. There was a lack of coordination on our efforts. One ministry was doing their thing, another ministry was doing their thing. So I feel like when it comes to policy, when it comes to ensuring that we have that nexus really working, that coordination and that partnership truly has to come to life. And it's only the likes of the donors and the partners that can make that happen. The second point I would make would be around how we promote our indigenous foods to deal with the issues around climate and even nutrition. I was inspired to start my food business, the healthy food business, because I wanted to create a market for farmers and specifically to buy African indigenous foods, what we call our superfoods. Things like fonio is on our menu. We do a jollof fonio, for example. It's filled with amino acids. It's 3 times the protein of rice. We have moringa as a smoothie. We use hibiscus. So these are all things that pretty much are natural to us and natural to our habitat, and our farmers are used to them. They're resilient crops. Many of them are drought tolerant. So all these shocks that come with climate change, all the shocks that come with different weather conditions and droughts and all, these crops stand the test of time. So it's critical for us to ensure that that is what we're growing, not just the staples and some of the imported foods that we are now seeing has become the norm in our country. So let's bring back our ancient miracle crops and let's start farming those at scale. And let's have the donors, the private sector, promote that as well, because that's the only way we can truly address these issues. Thanks.
Marie-Ange, Gavi's model of co-investment with African government is critical for strengthening immunization efforts. What have African governments committed to invest in Gavi programs this year?
Indeed, one of the strengths of the Gavi model has really been this co-investment with countries over the years. And we have really seen them drive their own immunization program, really take to heart the prosperous development of the children and, of course, ensuring, more economic opportunities. Again, I want to remind everyone that investing $1 in immunization brings $54 in economic benefits. So it's been incredible to see that the countries in this room have really walked the talk. Today, and I'm saying today, I'm very pleased to announce that government in these rooms have already co-invested $200 million, the highest investment today, the best performance in 5 years, to protect for the immunization of their population, to actually prevent, protect, and prosper. So I think it's really the testament, it actually shows that Africa is leading, and I'm really pleased to be able to make this announcement here because a few months ago, Côte d'Ivoire announced this initiative of the Abidjan Declaration, where they are bringing together other countries in the continent to even go further towards, that co-financing and sustainability. So really pleased to see this happening. And of course, many people in this room, and I won't give the name of all the countries, have made it possible. And of course, Côte d'Ivoire has been leading the way.
Thank you. Thank you, Marie-Ange. Monsieur le ministre Pierre Dimba, il est vrai qu'on ne vous a pas beaucoup entendu avec toutes ces femmes brillantes à vos côtés. On va donc terminer avec vous, puisqu'on est à la fin de notre conversation, justement en parlant de cofinancement. Quelle est la contribution de la Côte d'Ivoire à Gavi? Et quelles sont les prochaines étapes pour renforcer davantage la prise en charge du programme vaccinal de la Côte d'Ivoire?
Merci. Je voudrais dire qu'effectivement, comme je l'avais dit tantôt, notre système de santé est basé sur 3 piliers. Améliorer la prévention des maladies, renforcer l'accessibilité et faire en sorte que les épidémies soient maîtrisées donc, grâce à un système qui est mis en place donc, de veille qui permet donc de contrecarrer donc, toutes les épidémies. Et nous nous réjouissons donc du partenariat que nous avons eu avec Gavi depuis 2001 qui a produit des résultats importants, notamment plus de 16 millions d'enfants vaccinés. Ça a permis d'éviter plus de 230 000 décès évitables. Nous avons engrangé, donc, grâce à ce partenariat, plus de 530 millions de dollars sur la période. Et aujourd'hui, nous sommes fiers parce que le gouvernement, sous le leadership du président, a demandé que, compte tenu donc, de notre niveau de revenus par tête habitant, que la Côte d'Ivoire accepte donc d'amorcer sa transition vaccinale donc, avec Gavi pour permettre à d'autres pays plus fragiles donc, de rentrer dans ce programme. Donc la Côte d'Ivoire va procéder à un cofinancement et sur la période de 2023 jusqu'à 2030, c'est environ 336 millions de dollars que la Côte d'Ivoire doit mobiliser par ses propres moyens, ses ressources endogènes, donc pour assurer son programme de vaccination. D'ailleurs, nous y sommes puisque nous avons, comme elle l'a dit, introduit de nouveaux vaccins, dont le vaccin du paludisme, et nous comptons aller plus loin parce que nous sommes convaincus que ce n'est pas cet investissement que nous pouvons donc non seulement avoir des Ivoiriens en bonne santé, productifs, et qui construisent donc leur pays. Donc, pour l'avenir, ce que nous attendons de Gavi, c'est que même après la transition, nous voulons donc leur assistance parce que, ça a été dit ici, il faut que nos pays soient autonomes en termes donc, de vaccins. Nous avons vu qu'on a mis 15 mois lorsqu'il y a eu la Covid pour disposer des premiers vaccins alors que les autres pays développés commençaient à vacciner. Ça a été préjudiciable pour l'Afrique. Il faut qu'avec Gavi, avec CDC Africa, nous puissions développer dans nos pays donc, la capacité de produire des vaccins à des prix abordables. La deuxième chose, c'est que Gavi doit nous accompagner dans l'intervalle, avoir donc des vaccins disponibles et pouvoir donc vacciner dans les délais. Notamment lorsque nous avons introduit le vaccin donc, de lutte contre le cancer chez les jeunes filles, on a assisté à des ruptures parce que, bon, ben, écoutez, c'est pas toujours disponible et ça fragilise notre système vaccinal. Donc, il faut que nous puissions travailler à cela et en même temps renforcer les capacités des professionnels au niveau national pour que les résultats que nous avons eus pendant la phase de l'Alliance puissent continuer. En tout cas, voilà ce que nous pensons et nous sommes fiers d'avoir fait cette trajectoire avec Gavi et nous comptons, à partir de la déclaration d'Abidjan que nous avons conduite, encadrer les autres pays aussi pour que la transition se passe bien et soit une transition réussie.
Merci infiniment, Monsieur le ministre Pierre Dimba. Il faut que nos pays soient autonomes en vaccins. Il faut donc que l'Afrique puisse être autonome en vaccins. Merci à tous. Thank you to our incredible panelists. It is again clear that to ensure a healthy and prosperous Africa, it will need a collective effort from government to private sector to local communities. The challenge is great, but the solution does exist. So thank you to everybody. And
if I may,
yes,
I think I think we have seen here the great example of partnership. But as I mentioned earlier, there's of course government, but also the private sector that help us modernize the health system and that are also investing and really contributing in very innovative way. So on top of the incredible announcement that we just heard from the minister, to close the session, I'm really pleased to introduce an exciting video message from Zipline, that is the world's largest drone delivery service that, you know, has been starting to deliver vaccine with us here in Africa, in Rwanda, Ghana, 24/7, and we are very pleased that they are now extending the partnership here in Côte d'Ivoire and have announced, you know, another $500,000 for the commitment to help, you know, ensure a better future.